Good evening, everybody, to the Board of Health meeting on Monday, January 30th, 2023. And the first thing on the agenda tonight is the Board of Health is recording. Is anyone else recording? Great. Okay, I didn't screw that up. And also, we are meeting virtually tonight via Zoom webinar pursuant to former Governor Charlie Baker's executive order from March of 2020, suspending certain provisions of the open meeting law. So the first thing now on the agenda tonight is we need a motion to open the public hearing. Is anybody willing to make that motion?
I motion to open the public hearing.
Right. I second that motion. And Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Aye.
All right, so we are now in public hearing. So our folks from the health department, if you could just share with us, we are talking tonight about the proposed 2023 fee schedule for the East Long Meadow Health Department.
Okay, so we can go over it. For anybody who is listening in, there was a link on the public notice in the reminder that takes you to the website if you need to have a copy of it. Most of the changes in the fee schedule are in preparation for tomorrow, our go live date on our e-permitting site, to make it more simple, because having too many fields to click wasn't really an option for forms of payment. So the first thing we're doing on the first part where you see yellow, where it says food establishment, retail food service, is we are combining food service, retail food, bakery, and grocery into one food service application, which is very consistent with what people do in other towns. We're not changing the price of it. We're just combining everything, all those into one. And so if you are, say, La Fiorentina, who serves sandwiches, and you also are a bakery, you're just one food service establishment now. The second yellow area on the fee schedule is for temporary food service. Previously the way that we do it is we do it by day. So it was $45 a day, and then it was each day 1, 2 through 14. In the state of Massachusetts, temporary is anything 14 days and under. In order to make it a little more streamlined for when we go live on open.gov, we're doing it, we're having 3 tiers, a 1 day for $50, a 2 to 3 day for $100, and a 4 to 14 days is $175. And that 4 to 14 days will be more like things like our the carnival for the 4th of July and stuff like that. We are raising the 1 day from 45 to 50, just based off of the amount of work that goes into approving and inspecting. And then on the bottom, under environmental, these are all in regards to septic systems. The first 2 areas where it says disposal works plan review and disposal works construction, what we're doing is we're taking one application, which was just the disposal works construction application for $300, and we're cutting it in half, not in half, we're cutting it from $350 to $150 for the application itself, and then $200 for the plan review. And this is basically for not every application that's pulled out for a septic system requires a plan review. Sometimes it's just as simple as there's a little change to the distribution box, or the septic tank needs a little bit of concrete sealant or something like that. They'll need to permit, but they really don't need to go through plan review. And the same thing for if you're going to decommission, say a sewer line goes up to your house and you're going to decommission your tank and hook up to the sewer, that would be only a disposal works construction permit. And then the last one on the list is the soil suitability site assessment. And that is, for anybody who knows the lingo, is a perk test. And what we're doing is we're changing it from $150 for the first hour to $150 for the first 2 hours, and then $50 for each additional hour over that. This way we can charge people before we go out in the field. Usually, most of the time in East Long Meadow, 2 hours is about the amount of time for a perk test. Not too fast, not too slow, the soil. That way we'll be able to charge them ahead of time, whereas before we would go and then we'd charge afterwards. And to not charge for work prior to doing it doesn't make so much sense, especially if myself or Alex is going to be doing any review on the paperwork. So that's sort of the explanations of those 3 areas. Anyone here have any questions about that?
The temporary food service, when it's, these are consecutive days, right?
They can be, but they also might not be.
Oh, okay.
They could be, say this weekend and then next weekend, as long as
Okay.
it's not, as long as it's not past the 14-day period.
Okay. Perfect.
And then what we're trying to do is in the application, a farmer's market is going to be a tier, but that's not changing in its price. Should we see if there's public
Does
comment?
anyone else have any questions or comments? All right. Is anyone here from the public who has any questions or comments?
No.
All right. With that, ladies, are we ready to take a vote on this? Okay. Can I hear a motion to recommend the 2023 East Long Meadow Health Department fee schedule to the town council?
I motion. Oh, I second.
All right, great. Thank you. So roll call vote, Christine Johnston, aye. Dr. Katie Jobbins
Aye.
and Rebecca Torsha.
Aye.
All right. So the Board of Health has voted to recommend the 2023 East Long Meadow Health Department fee schedule. And we are recommending it to the town council to put it into the town bylaws. All right. Next thing up is we actually need a vote to close the public hearing and move into our public meeting.
I
So-
motion.
I second.
Thank you. Christine Johnston, aye. Katie Jobbins
Aye.
and Rebecca Torsha.
Aye.
All right. Thank you, ladies. Okay, so now we are in the public meeting aspect of our Board of Health meeting tonight. And so the first thing on the agenda is to vote to approve the minutes of previous meetings. And we have 2 sets of minutes. And thank you, Renee, for all of your help. So we have the minutes from November 2nd, which was our public meeting in November. And then we also have the minutes from Wednesday, December 7th, which was the public hearing. Okay.
Okay.
Does anybody have any questions or comments or concerns about the minutes as written?
On the December 7th, can we just add Liz's last name into behind what it says Elizabeth provides a description? That's Elizabeth Bone.
Yep.
I didn't see that before.
I don't, the version that I have just says a brief discussion occurred regarding, and then doesn't say anything after that. Is that on everybody else's?
That is on mine.
Yeah, that's on mine too.
That's on mine as well. Mhm.
But there's a little paragraph above it.
Yes.
Yeah.
Yes.
Elizabeth provides a description it starts with above it.
I don't know if that just needs to be taken out.
The bottom part,
Oh,
yeah.
I see what you're saying.
It's at the very bottom, yeah.
I think it doesn't matter. I will take out that bottom part and add Liz's last name.
Or just a brief discussion occurred on the topic. Is that maybe what you're attempting?
Yes.
Okay.
Yes.
Yeah.
Okay. Any edits or comments to the Wednesday, November 2nd minutes? Okay. If there's no further comments or discussion, can we have a motion to approve the minutes from the Board of Health meeting on Wednesday, November 2nd as written?
I motion to approve them.
I second.
Okay, Christine Johnston, aye. Dr. Katie Jobbins
Aye.
and Rebecca Torsha.
Aye.
All right, and then can we have a motion to approve the Wednesday, December 7th minutes with the addition of Elizabeth Bone's last name and then changing the statement to a brief discussion occurred on the topic?
So moved.
All right, I'll second that. And Christine Johnston, aye. Dr. Katie Jobbins.
Aye.
And Rebecca Torsha.
Aye.
All right. Is there anyone here for, oh, those minutes are approved. Is there anyone here for public comment for the public meeting?
No.
All right, so Tammy, business at hand, starting with the OpenGov online permitting update, which you mentioned briefly earlier.
Business at hand. So we've been, at first it seemed, it seemed kind of like it was so far away. And then probably after the last meeting, the group with the OpenGov said, we're going to go live at the end of January for your February renewals. So we've been meeting with them every week, kind of with a fine-tune comb, looking over our old application, creating the new one, and then putting it online. And as of this morning, I think it looks perfect. And so it'll be very easy when you want to apply for an application. Up at the top of the screen at eastlongmeadowma.gov, there's a little thing that says, how do I? And you can go, how do I? And then it'll say, apply for permits and licenses. And then it'll have a list of all the licenses that you can apply for. You go down to the health department and you'll click on, right now, the only two that are going to be live are food service and frozen dessert, because that's the cycle that's renewing in February. It's very strange. They expire on the last day of February, which is different every 4 years, right? Which might be something coming down the line. I wouldn't mind moving it to another part of the year to make it a little more consistent with other applications. I'm not quite sure why they expire on that day. Anyway, but then it'll walk you through. The great thing about OpenGov is that when you first go to use it, you create your own user identity. So no matter if you are, say you are Subway, if you apply for one in East Longmeadow, you can use that account. If you apply for one in a town that also has OpenGov, like West Springfield, you log in with that account. So a lot of your stuff already gets saved, so you're not typing everything in again. And it also uses a really neat kind of location service, so that it helps you pull up your application and then ties it to your parcel, so it makes it easy for collectors to see if you owe back taxes and everything. And then it's going to walk you through. And honestly, when we go through, if you start the process, making sure that you have all your paperwork like you did last year in front of you, it's very easy and it's very quick. And of course, if there are people who really can't apply online or have issues using computer, then they can come in and they can pick up a paper application, and we'll put it that way. But the good thing about it is that it's going to be entered into that database. So if they had issues this year with their first year starting, next year, all that stuff is already going to be in there for them. So all they have to do is sign in and do it. And the beauty of that is also that you can pay by credit card, which isn't something we had easily available in the health department. Or you had to walk them down to the clerk's office, and which, I mean, it's fine, but could be inconvenient for some people. So this way, it'll be a little bit easier way. Also, the printing of permits, we won't have to do that printing anymore. We won't have to do that mailing. They can do it right from after they've paid and it's been approved, it goes straight to them. So it's really nice. So hopefully by the summer, we'll have a nice portion of all of our applications online, with the hopes that we'll be eliminating a lot of unnecessary paper printing and mailing. So that's neat.
Will people be able to renew it every year once they, I'm just trying to think, like, once you've done it once, the next year it will be able to pull up everything. So you just kind of click like renew.
Yep. It'll have you walk it through it a little bit, because there's some things that you'll want to make sure, different certifications to make sure that they haven't expired. But other than that, just about everything, I believe when we went through it, just about everything pre-populates itself. There's a few things that we ask you to redo, like your say your food safety manager people. But other than that, it's kind of neat how it just, you know, makes it easy. And then, you know, if people do have issues downloading things or whatnot on the back end, we can be able to go through it. But hopefully it'll eliminate a lot of extra work on our end for this time of year, because this becomes very busy. Hopefully won't have any other issues coming in other than dealing with applications over the month of February. Let's see.
Cool. And you can do it anytime, which is the cool thing. You don't have to like be when the health department is open.
Exactly.
Although I'm sure y'all will be there to help.
I mean, we like seeing the businesses come in and everything like that. So, you know, but you also have the option, if you don't want to pay online, you can either mail in your check or come on into town hall and pay it that way too. So there'll be options for that. But this will be the busiest, I think, application renewal season, because the most number of permits we have are food service permits. So that's kind of neat. I'm excited. Let's see. Trash and recycling. So outside of the OpenGov, I feel like our lives have been lots of really great trash and recycling updates. So ever since the board approved the regulations, I know Liz and Renee have been like working with getting businesses addresses if we don't have their emails together, and putting letters together so that the all the businesses in town have all the latest information on the waste ban, also on our regulation as well. So then we'll take that information, and hopefully once people are a little more schooled on the topics of trash and recycling, then in the spring, we'll probably start doing some compliance checks to make sure that you are recycling. It can be apparent for some businesses, like you'll look outside and you can see a recycling dumpster and you can see a trash dumpster, but it might not be apparent for others. And one of the requirements is, you know, our offering of, you know, being able to offer bundling and being able to make sure you have, if you're a waste hauler, the different services. So we want to make sure that these services are offering these things to the businesses in town. Which, you know, it's 2023. We should be recycling. These laws have been around for decades now. The kids know how to do it, so our businesses should be able to do it too. And speaking of the kids, today I got the latest update on our organic waste collection program that's been going on since the beginning of the school year. And mind you, not all schools are doing this right now, and we've done it sort of staggering month by month. Like, so in September and October, we started with Meadowbrook, and then we moved to Mountain View. And now about maybe a week or two ago, Liz moved on to Maple Shade to educate the students there. And in a total, since October, we have collected 9,423 pounds of food waste, which is awesome. I'm like so excited. And I believe that Meadowbrook, which is our smallest group of, or our youngest kids, they've temporarily actually finally hired somebody to help the kids during lunchtime. I'm not sure whether or not they've made it permanent, but hopefully the school will be able to do that so that we can keep kind of keep the kids educated, because they still need that little tiny push. But I believe that they're doing really great in the other schools, and I'm not quite sure yet when we'll move on to the middle school or the high school, but I'm sure the numbers then will be skyrocketed, which would be so awesome. Let's see. And then, so right now we're just kind of trying to put the think tank together and figure out what to do with our recycling dividends grant for this coming year. And some of the things that we're thinking about is sort of looking around at like the parks and athletic fields where they have trash cans, because more than likely what's in those trash cans are recyclable goods, you know, water bottles and things like that, especially with the spring and the summer sports seasons coming up.
Well, the baseball fields, like when we have like it's like a jamboree, they're overflowing. So it would be great if there was an opportunity for recycling at those events too.
Which that's, you know, there's something that maybe when we talk to there's also a, what do they call it? A town property use application that people have to fill out. That might be something that we need to keep in mind, looking at those as they come in too. So that making sure that people are a little more responsible about their waste usage, because if they leave more trash than we can actually pick up, then that's something to look at. So I'm glad you brought that up. So let's see. And then right now we're beginning our planning for the East Long Meadow Earth Day cleanup event. It's scheduled for, and ladies correct me if I'm wrong, it's scheduled for April 8th, right? We didn't change that. It's for the actual cleanup date. And what we're thinking about to kind of streamline it so that people can hurry up and get into cleaning on that day is maybe having like a kickoff event at the library, because we're getting the libraries now involved. Maybe a couple days before, and get the vendors and whatnot, so that, you know, people can go around and look at all this stuff and not have to do it in their, you know, their boots and their jeans, and they can do it nice and clean and not full of dirt. So that I think that would be a nice way. And it will also be a nice way to display any of the artwork that the kids are doing at the schools, instead of, you know, taping it to the tennis court fence we did last year. So it would be nice to put there. I believe they're putting up a nice chair rail to display art in the community room. So that'll be a kind of a neat way to do Earth Day this year. Let's see. I decided to call our COVID update the COVID and other reportable diseases update, just because it was a really interesting winter season. In December, I believe Katie she's smiling. In December, if we were looking at flu, and these are just cases that are reportable, so if people went and got tested at a provider, there were 68 cases of flu. And then in January, there's only been 12. So definitely saw that spike with the flu. What about on your end, Katie? How did that look?
It's been something. The good news is all the numbers are downtrending.
Mhm.
We are still seeing a very large amount of community spread with both COVID and flu, but people are under, like you said, under tested. We're assuming people are either one or the other based off of their symptoms. There is a little bit of overlap of like symptom convergence, you know, like I have a cough or I have a fever. But the flu, obviously, what we're seeing is people are feeling like real sick. And then if you're vaccinated against COVID, you're feeling like you have a mild cold, but not as severe, which is a great thing. And obviously the numbers for RSVs have dramatically dropped as well too, which is also really good.
It feels a lot different than last January.
Yes.
Last January, I mean, the cases of COVID were just through the roof. It was.
Well, I think they still are, but there's a dramatic number of underreporting. And the good news is most people have very mild illness. We still are seeing some people sick in the hospital, but most people are like, yeah, I have this and then I have COVID. So it's not like you're coming in presenting as a primary infection of COVID. So last year, dramatically different. And then the other thing we're seeing is a lot of adenovirus, which was going around. So the GI bug, where everyone was getting like a upper respiratory tract infection, then they get a GI infection, and all of a sudden they'd have conjunctivitis. And so it was going through the colleges and like the schools a lot. And then people, like the adults, were like, oh, I kind of feel a little weird. And then I have an itchy eye. So the good news is people are thankfully all recovering very well. And you know, the most important thing is obviously just staying home if you're sick, good hand hygiene, all that good stuff.
Yeah, if you look at the last reporting period, which is January 8th through January 21st, there was 33 people who tested positive out of 367 people who actually went and had a test administered by a provider, not a home test. Which I believe this was the week last year that we were at like 699, but it wasn't as easy to get a home test, obviously, back then as it is now. This also is the first week since November that we've been lower than the county for our rates. I don't know. I don't know that what's the difference between what happens here and the rest of the county, but we're at 9.8 and the county is at 10.7 right now. Since the beginning of the pandemic, we've seen 5,156 cases in town. And in 2022, we saw 38 residents die of COVID, with the average age being 83. And our vaccination numbers have stayed kind of similar to how they've been in a bit. They've slowly have been going up. We're at 76% fully vaccinated, and 47% with their first booster dose and 21% with their second booster dose. And to round it all off, we still have quite a few boxes, big boxes of test kits. So if people still need them, they can call. We have certainly accommodated people who didn't have anybody to pick it up. We just, pull up to the health department, come out or town hall, open up your rear window, and we will throw the kits in for you so that you'll have them. Because we did receive a new shipment that is good till I believe the summer or early fall. So we have those. And that's that. We did see a bit of people traveling to Uganda over the holidays, and during the holidays. So what that did was that triggered alerts through the Maven network. And really what it is just a questionnaire about, where did you go? Did you see anybody that was sick? Just to establish if there's any possibility of the spread. But that actually was lifted maybe 2 weeks ago or so. And that they're no longer keeping track of that at the state level. That's it for, let's see, reportable disease updates. Other business. We don't really have any other business. I know Alex says next week they should be meeting the Tobacco Coalition, right? Or which group?
Oh, yeah, so I'll find out about the update on where the tobacco regulations are at the state level.
And that's all I have. Anybody else have any other business? Been busy. It was like town budgets had to be in by the 17th of January. We're very early this year to always, or our town is always very early just to prepare in advance for when the town council votes on the budget. This year, what was different was that instead of handing over our budgets to the finance department for them to input into the system, they decided that they were going to put it in our capable hands, and we had to learn how to enter into the system and put it in, which was neat. And I don't normally use this system as much as Renee does, but it was in, and hopefully everything will go well. I did actually, I put in a request for the health department and the Council on Aging to go in together on a full-time town health nurse, so that they would work part-time for health department, part-time for the Council on Aging, which we do a lot of things, especially with the flu and the COVID clinics and whatnot. And we're hoping that the town council approves it. If not, we'll figure something else out. Going through, we still haven't really had any real bites of qualified candidates for the public health nurse, but maybe it's still out there. It's still posted. So for the meantime, for the temporary, for our part-time position. That's it.
Mhm.
I'm going to say that, and then 30 seconds, I'm going to come up with something else.
We have the new housing code starting in April, so we're starting to do our trainings for that. So that's exciting. But that's it.
That'll be, yes, that's kind of an interesting topic. And, it's lovely that none of the trainings are in the Springfield / East Longmeadow area. You have to travel for them. I think Alex is going across the state for it.
Yeah.
Can you zoom in?
No. They had lots of, if you want to watch anything on it, they have their public hearings for when they approved it back in October. So you can watch that. And then it is available on mass.gov, but it just doesn't take into effect till April. They gave us plenty of time to train for it and get familiar with it. Because there's a lot of changes to it.
And a lot of the changes align public health code with building code and national fire code, because when these were first created, they really did not align. And some things might refer to see the building code, and some things might just be completely opposite from what it is. So it'll make it a lot easier on tenants and landlords, I think, to understand what it is that they need to change, or what's within their rights to call us up for.
Cool. Well, we're looking forward to hearing what you learn, Alex.
Yeah.
Great. Anything else, ladies?
I think I'm good. Yeah.
Okay. We have next meeting date here, and I think I'm excited to hear too what the state's doing with the tobacco regulations, so we can get back to work on that and hopefully be doing a public hearing on those tobacco regulations soon too. So hopefully we can talk about that at the next meeting.
When do we want to make a meeting for? Like, looking at the tiny font on the telephone calendar. The week of the 20th is winter break for the schools. President's Day winter break.
Should we look at the last week of March? Katie, what is your schedule? You're usually the one
Are
with the
we in
tightest-
February or March? Because does this count as our
Sorry.
February meeting?
No, this is our January
In-
meeting.
But
Sorry, I meant the last week of February. But
yeah, there's 2 days left
there's
of
2
that.
days left of that.
The
Yeah.
7th and I think the 28th.
I have meetings both those nights.
Okay.
I am not going away for February break. But if people are, I want to respect that.
I am.
We should respect that and do it.
Okay. Should we look at that? Do we have to meet in February, or can we do like a very early March meeting?
We could do very early March.
I feel like otherwise we're going to be meeting in 2 weeks and we'll have
Yeah.
nothing to talk about.
Right.
Right.
Because what is the rule? There is a rule, Alex. You had told us this before, like how many weeks had to go between them at most.
I didn't think there was any.
I thought there was a rule. No?
No.
There's some that meet quarterly. There's
Oh,
some that-
okay.
You don't have to meet every month. That's
Okay.
okay.
February's a really short month too, so.
It is.
It is.
Could do. Oh, crud. People have already added so many meetings and I'm like. Okay, what are the best days for you guys? Tell me that and then I'll start looking at like the days of the week. Because I know
I-
sometimes there's conflicts with other meetings.
Yeah, no, I mine are just one-offs. So I have a meeting the March 1st and March 8th, but like then otherwise Wednesdays are okay. It's just
Okay,
mine are particular days.
because I could do March 15th.
Yeah, I could do that.
Yeah.
It's a Wednesday, I assume.
It is.
Because
Just
Mondays are very hard normally for me to just get out of work and get home and
I think Mondays are a hard night anyway, back to the grind in the beginning of the week and
yes, I feel like it's
So-
like,
So March 15th.
Yeah.
At 6, we like 6, right?
6 works
That's
great.
good.
This is good.
Put it on my calendar this time.
I'm gonna send a
Will
meeting
too.
invite out so that we'll
Okay, good.
have it in our calendar.
Okay.
Great.
Thank you so much. And as always, call us, if anything
Yeah.
pops up, we will always figure it out for you.
Yeah, there's no weird holidays there, right? No.
No,
no, and there's no school breaks or anything.
I'm on school break, but I'm working because
Oh, that's right, the colleges.
Right, the colleges
It's a
are on
long
break.
month.
I leave
Yes.
Friday to take my children out of school to go to Disney, so I can do that Wednesday. That's fine.
We got it. Okay. All right, can we have a motion to adjourn the meeting?
I motion to adjourn.
I second.
All right, Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right, the meeting is adjourned. Thank you, ladies. Have a great evening.
Thank
All
you.
right,
You
everyone
as
take
well,
care.
ladies. Take care.